So we have a weight loss program that we have in the office, and a lot of patients have a hard time getting the protein in. So we just decided to come in here. We need the shop anyways for ourselves to talk about protein. So most people, if you get between 25, say to 35 per meal, if you're eating a couple of times a day, you should be able to hit a good amount of protein. Protein typically helps with muscle recovery, but also helps keep you full a little bit longer, helps stabilize your blood sugar, so it kind of prevents you from, wanting to sometimes eat like the sweets and things like that. Because a lot of times if our protein is too low, we tend to crave other things. Additionally, if you're trying to lose weight, obviously if you're working out, most people know you need to eat protein, but if you're trying to lose weight as well, you typically need to keep your protein a little bit higher to prevent that muscle loss. Because typically when you lose muscle, you actually end up losing, you end up having a lower metabolism, which then it's harder to lose weight. So protein powder is something that you could throw into. One of the things I do, maybe not the most appetizing, is I will use some oatmeal, microwave that, and then I'll throw in some protein powder in that, and then typically I'm able to get anywhere between 25 again to 35 or even 40 grams of protein. I typically eat that in between patients. It kind of keeps me full, keep my energy up. There's like plant-based protein, there's what's called whey protein, there's also casein. The most commonly protein is usually whey protein. Casein is a little bit different. I know I've experimented a little bit with more plant-based. There's a little bit of pros and cons with that. If you have questions about that, feel free to reach out. I started taking a couple things myself. So I currently take some creatine, which is like a muscle building supplement that is used for muscle recovery. That's actually very well researched. Glutamine is something that's we use a lot in some protocols in the office where people have like gut issues and things like that, but glutamine also helps with muscle recovery. So typically glutamine comes like in a powder form. There's about like 4.5 grams here, so typically I take that about once a day. Sometimes you just crave, potato chips, and maybe that's not the best option for you. So a lot of times I will supplement with these. The key with these that you want to watch out for, with some of the things we're actually taking, you just want to pay attention how much sodium they have. Some of these things tend to have a little bit higher sodium, so you just want to make sure you're watching your overall sodium intake. And then typically, if you're eating out, you tend to have more sodium in the foods you're eating out as well. So you want to kind of try to balance that a little bit more. But if you guys have any questions about anything we talked about any supplements or any protein intake questions or anything like that, feel free to reach out. Thanks for watching the video. We'll see you the next time.